Hello viewers, you are welcome to a new episode of our educational video. In this video, I will be talking about roles of kidney in human body. The kidneys are two bean-shaped organs about the size of a fist, located near the middle of our back, just below the rib cage, one on either side of the spine. It is made up of functional units called nephrons. The kidneys altogether receive roughly 25% of cardiac output, amounting to 1.2 to 1.3 liters per minute in an adult individual. The roles and function of the kidney in human body. These roles include the following: the excretory role, the regulatory role, the endocrine role, and the metabolic role of the kidney in human body. On the excretory role of the kidney in human body, the word excretion means removal of metabolic waste product eliminated in urine, like urea, which is the waste product from protein metabolism, creatinine, which is the waste product from Moses metabolism, uric acid, which is the waste product from the breakdown of nucleic acid, bilirubin, which is the waste product from the breakdown of hemoglobin, other substances such as drugs and toxins. In clinical practice, in order to determine the functional capability of the kidneys, we have to look at the urea and creatinine level of the blood. But we have to know this very important point. In a case of dehydration, when a patient is hypovolemic, you may find increased level of urea in the blood, which is called uremia, whereas the creatinine level stays normal. The reason for this is because when a patient is dehydrated, there is increased absorption of urea by the kidneys. Uremia does not tell us that the kidneys are working properly. Therefore, blood creatinine level is the world standard to determine the excretory function of the kidney. Second is the regulatory role of the kidney in human body. The kidneys regulate water balance, meaning if we drink more water will be removed from our body by the kidneys. Less water we drink, kidney retain more water in our body, thereby preventing dehydration. The second regulatory function of the kidney is the control of electrolyte balance in the body, such as sodium, potassium, chloride, bicarbonate, calcium, and acid-base balance. Now, endocrine function of the kidney. The kidney secrete the following chemical substances. Number one, erythropoietin. Erythropoietin is also known as EPO. It's a hormone that the kidney produces to stimulate production and maintenance of crucial red blood cells. This hormone does this in two ways. The first is it stimulates bone marrow cells to produce red blood cells. Then it works to protect the cells from destruction once they are in the body. Low level of erythropoietin occurs when someone is suffering from chronic kidney disease. Low red blood cell count causes anemia. Activating of vitamin D. Vitamin D comes from two sources in people. It could either be exposure to the sun ultraviolet B radiation, or it will be absorbed from food or food supplement we eat. The kidneys convert vitamin D absorbed from supplement or from the sun to form the active form of vitamin D, which regulates calcium and phosphate homeostasis to make strong, healthy bone. Deficiency of this can lead to a loss of bone density, which contribute to osteoporosis and fracture. The secretion of renin. Renin is an enzyme produced by juxtaglomerular apparatus cells in the kidney, which senses changes in renal perfusion pressure. Renin primary function is to eventually cause an increase in blood pressure, leading to restoration of perfusion pressure in the kidneys. Renin is also involved in renin-angiotensin-aldosterone system, which regulates water balance, electrolyte balance, and blood pressure. In an end-stage renal disease, aldosterone tells the kidney to retain salt and excrete potassium. By retaining salt, the body keeps more water in the system. This water raises the blood volume and blood pressure. Kidneys affected by end-stage renal disease sometimes make too much renin, which keep blood pressure high. Another endocrine function of the kidney is the production of prostaglandins. Prostaglandins, these are hormones-like substances made from lipid. Prostaglandins appear to play a role in the regulation of renin-angiotensin-aldosterone system, modulating both renal blood flow and renal tubular sodium reabsorption. One of the most striking actions of prostaglandins is their capacity to dilate peripheral blood vessels, thereby lowering the arterial pressure. Prostaglandins regulate blood pressure, renal blood flow, renal sodium and water excretion. the metabolic function. The first and important metabolic role of the kidney is ammonogenesis, which has an important role in acid-base homeostasis. Also, during starvation, the kidney has ability to produce glucose through gluconeogenesis. In summary, the total blood volume in an average adult is about 4 to 5 liters in female, while 5 to 6 liters in male. Blood makes up of about 8% of the total body weight. This blood passes through the kidneys between 20 to 25 times each day, meaning that altogether, this organ filters about 150 to 180 liters of blood every 24 hours. The ingredients in our blood are constantly changing as we ingest food and drink. The buildup of waste will overload our system. These magical beans balance the amount of fluid in our body. They take and remove waste in our blood in form of urine. Know when to release vitamins, minerals, enzymes, and hormones we need to stay alive. Say hello to your kidneys for a better living. Thank you for watching. Please don't forget to subscribe, like, drop your comment. Remember to click on the notification button for more updates at KB Nurses Documentary. See you next time.